Normally on this channel, we talk about the tech job market. And because it's tech, usually, unfortunately, we have to talk about the high number of layoffs that happen on a weekly, monthly, yearly basis. But today I want to talk about a different industry, so hopefully you'll join me for this conversation too, because this is an industry that we see a lot of commenters say, just get into this industry and you'll have more stability. Your job will be a lot more valued. You won't have to worry about getting laid off or restructuring or all the kinds of same issues that you have to worry about when it comes to technology. They tell me the glory days of technology are well behind us and that the machines and the robots are eventually going to take all of our jobs, so get into this industry. But I have some articles today that show that the industry in question isn't doing as well as the general commenter would suggest that it's doing. And over the past 1 or 2 years, things are not going as well in this sector as they used to be. That sector being nursing and healthcare. And I have a few articles today that will go over exactly what's happening in the state of nursing and in healthcare in the past year or two. Let's dive in. Our first article is from Quartz, or QZ.com. And as always, the articles I reference are listed down in the description below, so you can read the whole thing. I'm just going to go over the highlights and how it pertains to our conversation for today. The headline is, "Layoffs are plaguing the healthcare industry too." And the article says, "Tech and media layoffs have made big splashes across news headlines, but another industry's workforce has faced troubles too, healthcare. Job cuts in U.S. healthcare last year totaled nearly 60,000 people. So in 2023, we saw healthcare lose 60,000 people due to layoffs. Now, unfortunately, in the industry that I work in, technology, that's just a drop in the bucket. But 60,000 people is still a lot of people to suddenly lose their job. It's one thing if you find a new opportunity and you leave for greener pastures, whether that be more money, more benefits, or better working conditions. But just to lose your job from out of nowhere, one person is way too many because everyone has a family and mouths to feed. But 60,000 is still a lot of people to suddenly lose their jobs. And that 60,000 people is up more than 90% from 2022. So it's one thing if an industry or a sector is not where you'd want it to be, as long as it's going in the right direction. But we've talked about the technology sector and firms in general, how in a report we read the other day, the technology sector from July to August, the amount of layoffs went up 3 times. So things have not been going well for a couple of years also in technology, but just to see the numbers getting that much worse in just a span of a month is really terrible to see. And then we go to nursing here and we see for the year of 2023, it's up 90% from where it was in 2022. So certainly another industry going in the wrong direction. The health sector fell only behind tech and retail when ranked by the number of layoffs in 2023. And retail is certainly struggling. I mean, most malls that I've gone to around Florida, I don't know how it is in your state, really seem to be ghost towns. I mean, when I was growing up, I would just hang out in the mall. There'd be all kinds of things to do, to just go there for some people watching, go check out a movie on a Friday night, get some desserts, whatever. But many malls, at least around Florida, just look like abandoned warehouses. It's really quite sad. And just retail in general, why buy online when it's much harder to return something than it is if you just buy on Amazon? And at least in Florida, you can take your Amazon purchase. If you don't love it, you don't even have to give a reason. You just drop it off at like a local UPS store and they send it back and credit your account. Really, no questions asked. And then the prices on Amazon are so good. And then if you have Prime, you get it basically right away. I mean, some items you order on Amazon, you get literally the same day. You can order something in the morning and get it that night. And it ships right to your house. You don't have to leave your house for any sort of reason. And then you're good to go. You have your new product and you didn't have to leave the house and you didn't have to pay any extra money. And you get it right away. You might get it quicker than having to actually go out to the store in some rare scenarios. And then sadly, we also have tech, which we document almost each and every day on this channel and all the struggles going on with technology these days. Nearly 1/3 of US healthcare workers surveyed in a recent industry report from software company Tebra said they witnessed layoffs in the workplace last year. The slashes have continued into 2024, with cuts hitting workers at Amazon's health division, Pfizer, and a slew of biotech companies, among others. Layoffs have mostly hit managerial and administrative staffers rather than patient-facing roles. Hence comes the tension. Just as cuts have surged, so too has hiring. In January, healthcare made up 20% of all job growth in the US economy. The industry also added more than 20% more jobs than it did on average in 2023, according to the Bureau of Labor Statistics. These jobs are mostly in ambulatory healthcare and at hospitals and nursing facilities, as employers look to fill those patient-facing jobs. The current state of the healthcare sector, characterized by both significant job growth and notable layoffs, reflects its ongoing adjustments to economic pressures and technological advancements. The persistent demand for clinical roles amidst an aging population and expanding healthcare needs indicates that the sector continues to grow, even with job cuts hitting non-clinical positions. Our next article is from Becker's, and the headline is 3 Notable Nurse Layoffs in 2024. So far this year, nurses have been included in job reductions at Optum and 2 hospitals. At least 41 hospitals and health systems have cut jobs this year amid industry-wide financial and operational challenges, though patient-facing clinical roles are often spared. Below are 3 layoffs involving nurses Becker's has reported on this year. Note, this is not an exhaustive list. That's a sidewalk, ladies and gentlemen. So this is the second article to say that, well, maybe if you're a nurse, things are okay. If you're patient facing, you're okay. But any sort of support like administrative or anything else like that might really be in trouble. I think someone left a comment the other day that they went to Quest Diagnostics and there was no one to even take their appointment. There was just like a kiosk that they were supposed to go and check in, and basically that's what was going to replace the front of the house person, and then eventually a nurse will come out and speak to them. But clinics and hospitals are also finding different ways to use technology to eliminate as many people as possible. And maybe they're not at the point where they can replace doctors and nurses yet, but I'm sure they're trying to figure that out. Plus, we have any sort of support staff who think, oh, well, I'm going to make a difference. I'm going to at least work in the medical arena, even if I'm not a nurse. But those people seem to be really struggling, and probably the bulk of all the layoffs that have happened over the past year in the healthcare industry. And we might be a little bit numbed to some of these numbers since we talk on a regular basis about 7, 11, 15% of staff being laid off. We talk about 6,000, 10,000, 15,000 people, but this is still pretty significant, especially if there are smaller hospitals to just lay off such a high number of people, even if it's not the outlandish numbers that we see in technology. So the article says, Portland-based Oregon Health and Science University has cut a telehealth nursing unit affecting 21 jobs. So that hospital not just letting go of 1 or 2 people, but a whole nursing unit. Ridgecrest in California Regional Hospital cut the jobs of nearly 30 registered nurses and 7 licensed vocational nurses as part of 2 separate rounds of layoffs. So here we have a hospital in California not just getting rid of administrative staff, also getting rid of nurses and licensed vocational nurses. So I guess RNs and then licensed vocational nurses. The hospital suspended its labor and delivery unit to avoid closure, citing declining birth rates and recruitment challenges. United Health Group's Optum is terminating more than 524 employees across clinics and administrative offices in California. The layoffs included an unconfirmed number of nurses, and LinkedIn posts from terminated employees indicate jobs at Landmark Health have been affected, including nurse practitioners. The Huntington Beach, California-based company became part of Optum in 2020. Well, Becker, you led me down a path to think that it was going to be mostly administrative, and now you're giving me all these examples of actual registered nurses being laid off as well. Our next article is from ideastream.org, and the headline is, University Hospitals Eliminates More Than 300 Jobs. And the article goes on to say, University Hospitals, the second largest employer in Northeast Ohio, announced Wednesday it was laying off more than 300 employees. The vast majority of the eliminated positions were non-clinical leadership staff, the hospital said in a press release, adding the layoffs would not impact patient care. Thanks to a variety of challenges, including increased access for patients and implementing a new electronic health record system, our revenue has increased nearly 9% year over year, but the growth is offset by soaring costs, the release said. As a result, this week we made the difficult decision to reduce the health system's leadership structure. The layoffs reduced hospital leadership by over 10%. These decisions are never easy. The important thing is that we make these strategic moves now so we can continue to serve our community and fulfill our mission for decades to come. The hospital blamed rising deficits for the layoffs. Medicare reimbursement rates that are not keeping pace with rising costs are some of the reasons for these deficits. UH, like health systems across the country, has endured financial challenges over the past few years. The layoffs are part of a plan to improve efficiency and shutter hospitals in Bedford and Richmond Heights, the hospital said. The affected employees would receive severance packages. Hospital representatives did not immediately respond to requests for additional comments. And I know, a hospital is just a business, just like a university is just a business, but shouldn't people want to just generally help people? I mean, shouldn't people get into nursing and into being a doctor and running a hospital because they want to help sick people? Because they want to give people a better quality of life? Because they want to alleviate the stress and the burden of, getting sick or getting ill, which is mostly outside of your control? I mean, come on. And even if you have a small private clinic, it doesn't seem to be much better. It just seems like, I don't know what the doctors are afraid of. Are doctors afraid of getting lawsuits for malpractice filed against them? Are doctors afraid of giving someone the wrong information and getting sued for other reasons? It just doesn't seem like anytime you go to the hospital in the USA, you even talk to a doctor. And if you do talk to a doctor, it's after already talking to a nurse, getting all your questions really answered by them. The doctor's in there for 30 seconds and they go bill a crazy high price to your insurance company. It doesn't seem like you're getting a good quality of healthcare, even though you're spending so much money. All we talk about in the States is how good our healthcare system is, and at least you don't have to go to Canada and wait around for it. But is our health coverage really good? I mean, outside of an emergency situation, wouldn't you want to wait a little bit longer and actually be able to have a nice sit down with a doctor, as opposed to just talking to them for 30 seconds and they act like you're bothering them, you're annoying them, they got other people to see, and get the heck out of here? I mean, doesn't seem like what we're doing is what the rest of the world should strive for. Our next article is from WSWS.org, which stands for the World Socialist website. Hopefully they're not talking about things I think they're talking about here. But the article is headlined, Mass Layoffs in the U.S. Healthcare Industry Carried Out to Maximize Profits. The healthcare industry in the United States is laying off tens of thousands of workers to shore up profits, threatening to stretch a badly understaffed healthcare system past the breaking point. According to a report by Challenger Gray and Christmas, the healthcare sector laid off 56,560 jobs in 2023, a 91% increase over 2022. All right, so we're seeing similar numbers, even though the name of the website is kind of crazy. Mark Zandi, chief economist at Moody's Analytics, candidly observed in the Washington Post about the mass layoffs. That is the way the American capitalist system works. It's ruthless when it gets down to striving for profitability and creating wealth. It redirects resources very rapidly from one place to another. But the layoffs in healthcare are particularly sinister because they are taking place amid the second highest wave of the pandemic, while the government has shut down all public health measures. The elimination of federal pandemic funding has only exacerbated the cuts. This is an attack on the basic social right to health care, which the ruling class increasingly views as a wasted expense. Even the figures cited by Challenger Gray and Christmas are a vast undercount of the real staffing situation because they do not include the countless healthcare professionals who have been driven out of the system entirely by impossible and dangerous working conditions. The attack on healthcare is also aimed at one of the most active segments of the working class, which is striking against stagnant pay and worsening working conditions. According to the figures collected by the Bureau of Labor Statistics, 16 out of 43 major strikes last year were by healthcare workers, involving more than 112,000 workers combined. Cornell University's Labor Action Tracker found 192 strikes and labor protests last year by healthcare workers. The trade union, however, fought tooth and nail to limit these strikes and impose sellouts, as it did in the strike by over 70,000 Kaiser Permanente workers late last year. A review by Becker Hospital CFO report last month found that 105 hospitals and healthcare systems have cut jobs across the United States. Job cuts over the last 6 months include, and then it just gives a full list of state by state all the job cuts. I'll just talk about a couple here briefly. In Illinois, Chicago specifically, 2 major medical centers, University of Chicago and Rush, have let employees go, citing financial struggles for these decisions. UOC has terminated 180 workers, 2% of its medical staff. Its president noted outside pressures, including high supply and labor costs, are converging as healthcare delivery rapidly evolves. Additionally, we grew our staff to address the pandemic, which was necessary for that moment but cannot be maintained. Rush has not disclosed how much of its staff has been axed, but said in a written statement, in response to financial headwinds affecting healthcare providers nationwide, Rush has undertaken a restructuring resulting in elimination of some administrative and leadership positions. In California, Kaiser Permanente is laying off an additional 79 administrative employees after cutting 115 tech positions in December and 49 more administrative positions in October. John Muir Health laid off 164 employees in Concord after it sold its home health services division. Tri-City Medical Center in Oceanside let go nearly 100 employees to align operations with the decline in hospital volume. Southwest Healthcare's Palmdale Regional Medical Center suspended its maternity services and fired 87 workers. And in Florida, my state, 60 employees at Coral Gables of Florida-based Baptist Health were voluntarily separated in November. River Medical Center, part of the Dallas-based Stewart Health Center, has reduced its workforce, claiming this is a reflection of hospital volume and normal market fluctuations. More than 80 people were let go in 2022. The 178-bed facility has a medical staff of approximately 100 physicians and 500 nurses and ancillary staff. And then the article says, many news outlets have emphasized that the cuts in healthcare are falling predominantly on administrative staff and upper-level management under the auspices of reducing redundancy and improving organizational efficiency. But these job cuts signal a deepening of the merger, acquisition, and monopolization of the healthcare industry, which will see a further deterioration of quality of care at the expense of profit. Not too long ago, during the pandemic, there were a set of folks who, and I can't remember the word, let me know, but were mandatory, were critical to keeping our country afloat. And no matter what was going on, they had to show up to work. And some of those mandatory people were nurses, because as people got sick, as people got ill, someone had to leave their house, come into work, and be able to care for these people. Now, just a few short years later, are they getting promoted? Are they getting more money? Are they being rewarded for literally putting their lives on the line? For getting sick, for getting ill, for not just putting themselves in danger, but their friends and their family in danger as well by being on the front line here? No, they're getting laid off because healthcare, like we've said, unfortunately, is just another business. And the government doesn't care about you, and your boss doesn't care about you, whether you work at a hospital or whether you work at a tech firm. So it's just pretty sickening just to see the fall from love and appreciation that our medical professionals are seeing, because the nurses went through so much to keep us all safe and healthy, and now they're getting laid off. And that's not the news you're going to hear everywhere. And even from these reports, there's some mixed signals, but it's not surprising, unfortunately, with how much profits and how much revenue these hospitals want to make, that they're going to let go of registered nurses, and not just administrative people, but the people who literally put their lives on the lines for the health and the safety of all of us Americans. So unfortunately, if you thought you could just leave your job in tech and go get a job as a nurse or somewhere else in healthcare and you'd be safe, unfortunately, that's just not the case. So being a nurse and working in the healthcare industry also has its own troubles, and it's also facing layoffs. Talk to you later.